I am deeply appreciated that the Pontifical Academy of Science and World Health Organization made this great opportunity for me to share current strategies to serve patients with organ failure in a country under disease donor shortage. The disparity between the end for solid organ transplant and the organ availability is profound and growing in most countries. Much interest and activity has centered on increasing organ availability, but another approach to addressing the gap between the need for solid organ transplantation and the availability of organ is to decrease demand. Next slide, please. Japan is an important example of a country which has decreased the need for liver replacement by aggressively approaching hepatitis B, hepatitis C, and primary liver cancer. Successful decrease in hepatitis and ACC as a result of national policies such as maternal survey for hepatitis B surface antigen, infant vaccination, blood products screening for hepatitis B and hepatitis C, hepatitis screening for all residents younger than 40 years, routine meticulous screening for ACC in the Japanese ACC guideline, and public full coverage for hepatitis treatment has led to a decreased need for liver transplant. Next slide, please. Japan is also an example of a country that has well developed live donor liver and kidney transplantation, but a poorly developed decreased donor program. The lack of a deceased donor program severely inhibits the ability of Japan to meet the need of patients with end-stage renal diseases and end-stage liver diseases. Next slide, please. Japan has made big efforts to expand living donors. One of them is ABO incompatible transplantation. Due to scientific innovations, ABO incompatible transplantation reaches to 20% of liver transplantation and kidney transplantation. The outcomes are compatible to identical and compatible transplantation. Next slide, please. Japan has also led in the context of long-term follow-up of both liver and kidney recipients as well as their live donors. Short and long-term morbidity and mortality has been captured. The limitations of these registries reflect the voluntary nature of patient follow-up. Japan developed a prospective survey system for living donors by effort of academic societies. Among 2,443 live liver donors from 1989 to 2019, one mortality relating to operation and 78 mortalities in long-term follow-up were noted. Malignancies, cardiovascular diseases, intracranial vascular diseases, and suicide are major causes of mortality. Next slide, please. Further evolving development of deceased donor liver and kidney transplant, inadequate donor numbers leave thousands of patients with end-stage organ disease without treatment. More live and deceased donors are necessary. Live kidney donation has proven to be safe when performed under an appropriate framework of donor care, even though an inevitable small mortality risk is well documented. Transplantation of kidneys from live donor is considered a necessary adjunct today to achieving a national self-sufficiency. Next slide, please. Registry for Live kidney donation was begun in 2009, and 14,323 live donors from 2009 to 2019 were registered. Next slide, please. Among the 14,000 live renal donors, 53 patients died. Major causes of mortality were malignancies, intracranial vascular diseases, and pulmonary disease. Next slide, please. Yes. 50 live donors showed obvious proteinuria after a year of donation, and 2 donors reached end-stage kidney disease requiring dialysis support. These findings emphasize necessity of longitudinal medical and mental care for live donors. The fact that 20% to 30% of donors quitted visiting outpatient clinic mainly due to their decision hampered this registry. One of possible reasons is that the costs for the medical check and treatment are not fully covered by medical insurance in Japan now. Next slide, please. Furthermore, the Declaration of Istanbul calls upon the government to ensure the protection and safety of living donors, recognizing their heroic act while combating transplant tourism, organ trafficking, and transplant commercialism. Registries of live donor transplants should focus upon the safety and well-being of the live donors. Complications that require treatment and rehospitalization should be recorded. And of course, donor deaths associated with the procedure of organ removal. Thus, registries provide important data to base the donor's consent on the assessment of known risks. Government should support to decrease missing data of the registry. Thank you for your attention. Thank you very much.